Welcome at the fourth edition of the SensUs competition here in Eindhoven. My name is Annabel Romein, and I will be the Master of Ceremonies today. I studied physics at this university, graduated last year, and then decided to do a second master to become a teacher in high school. So I started last week teaching physics to high school students, so that's really exciting, good start. But back when I was studying physics, in my first year, I had to choose a course. And that course, I had some choice, but eventually I actually didn't, because there was only one course that I could choose, which was biophysics, which I did not want to do, because I thought I'm here for physics, so why should I now learn about biology? So I went to my first lecture, and then found out that I was so interested in it and so mesmerized by it that it became the direction that I graduated in. So actually a good thing that I found out already during my first year. So you can imagine that it is, for me, a great honor to stand here today because, of course, I'm interested in biophysics, in biosensors, and this event is all about this. So you all know that the biosensors can change our lives. They can increase the quality of our life. Because previously, you had to go to a hospital, maybe somewhere in the country, far away, maybe not even in your country, and they had to do a test, and then you wait for maybe 2 weeks before you hear if there's something wrong with you, or if you're getting the right amount of medicine. Now, sometimes biosensors are there, and they can tell you whether or not something is wrong with you in the span of maybe 10 minutes. So then you can go to the hospital, or they can adjust the amount of drug that you get. And that can really increase the quality of life, how you live. So I think it's very important and very good that we have 14 teams here today who have developed a biosensor to measure adalimumab, a drug for rheumatics. So I would like to start by asking for an applause for all these teams that are here today that have developed a biosensor. And we'll see today whether or not those biosensors that they have developed are actually successful, and maybe a startup company can come from it and an actual biosensor can be commercialized. So that's all very exciting. We're going to start this opening ceremony right now, and the first talker of this morning is the chair of the SensUs organization. So I would please like to ask Kirsten Peter to the stage. Please give a warm welcome.
Thank you, Annabel, for introducing me. And hello, everyone. Welcome to SensUs 2019. Welcome to the finals. Today is a day in which I want to welcome not only the teams, the student teams, the universities, and all the guides and supervisors, but also I want to welcome healthcare professionals, company representatives. I want to welcome the jury, of course. Thank you for being here. And I want to welcome friends, family, and everyone else in both our offline and our online audience. Today is an exciting day for all of us. For example, for the student teams, who've been working towards this day for 9 or 10 months already. Today you'll finally get to show your product to the world. It's also exciting for healthcare and companies because today we'll get a glimpse of the near future of healthcare. I hope you're just as eager to see what the teams have come up with as I am. And lastly, of course, it's very exciting for the SensUs organization. Because while I'm standing here, welcoming all of you, I'm not speaking for just myself. I'm speaking for 38 students who've been working very hard to make this event possible today. And today they are all recognizable by their red SensUs polos, like the one I'm wearing right now. So if you have any questions, you can always come up to us and we're all open to answer them. So the SensUs organization is guided by Professor Menno Prins. You can see him here on the slide. He's also in the audience here. He's waving. He's here over here. So Menno will also be wearing his SensUs polo today, so if you have a question for him, you can ask him as well. And Menno is not only our professional and personal guide, he's also the founder of SensUs. And why did Menno actually found SensUs? Why are biosensors important, and how do they work? The next video will explain all of that to you.
A molecular biosensor is a compact device that measures specific molecules for informing us about health and disease. The measured molecules are called biomarkers. A biosensor operates on a sample taken from the body, for example, a drop of blood, or it can be worn on or inside the body for giving continuous measurements. The most well-known biosensor is the glucose sensor, which measures the concentration of glucose in the blood or in the skin. This is very helpful for patients with diabetes. With a biosensor, patients and doctors immediately get the information they need in order to optimize treatment, reduce unnecessary hospital visits, and enable self-management of health and disease. A biosensor consists of 4 major components: a molecular recognition process, a signal generation process, a disposable sensor device, and a reader instrument. Recognition molecules in the biosensor bind to the biomarkers. The recognition molecules are, for example, aptamers, enzymes, or antibodies. The molecular recognition leads to a signal, for example, an optical, electronic, or magnetic signal. All this happens inside a disposable sensor device where the molecules come together. Finally, the reader instrument measures the signal and translates it into information that is meaningful for the user. There are many diseases and many biomarkers, each having different measurement requirements. Also, there are many technological ways how a biosensor can be designed. That's why SensUs was founded, the annual international student competition on sensors for health. The SensUs community accelerates the development of new biosensors for a better quality of life.
So, in the last few years, SensUs has covered different topics. And this year, the theme of SensUs is managing rheumatic disease by measuring with ease. Rheumatoid arthritis is a disease that affects about 1% of the world population. It's an autoimmune disorder in which patients suffer when their immune system attacks their own joints. People with this disease live in constant pain, and simple everyday business, like doing the groceries, can be a really painful and difficult event for them. So over the years, several medications have been developed to slow down the progression of this disease and to help people with this disease. And one of those medicines is called adalimumab. Adalimumab is the best-selling drug in the world. And that is because it's not only used by a lot of people, it's also very expensive. Adalimumab represses the inflammation, and it also protects the joints from permanent damage. And that way, it relieves the symptoms of the disease. However, not everyone reacts properly to this drug. Some people may lose their benefits over time. Some people may not benefit at all from it. A biosensor could help to detect these problems early, and in that way, it could prevent unnecessary suffering of patients. So now I would like to show you a short video about Wendy. And Wendy was diagnosed with rheumatoid arthritis when she was very young. And right now, Wendy is the chair of Youth Are Well, which is an organization for students or for young people that have this disease. And today, in this following movie, Wendy will tell you something about what it is like to live with this disease at her age.
Hi, my name is Wendy and I'm 24 years old. I'm currently a PhD student at the Eindhoven University of Technology. When I was around 14 years old, I got the first symptoms of arthritis and it started with pain in my hips and in my elbow and in my jaws. And then, because I was very young, they didn't really know that it was arthritis, so it took them around 2 years to finally diagnose me with rheumatoid arthritis. With arthritis, I can do almost anything I want, but I just have to do it at my own pace. For instance, I work 40 hours as a PhD student, but I cannot sit at a chair for 40 hours a week. So that's why I try to work, for instance, more at home. Having arthritis means that I have a lot of pain and inflammations in my joints. That's mostly in my hip and in my elbows, and I'm also really easily tired. I think the best and also the worst thing about having arthritis is that it is an invisible illness. So that means that when you're having a good day, you can pretend that nothing is wrong and you can have the best day of your life. But when you have a bad day and you really want people to help you, they cannot see that you have an invisible illness. A short while ago, I started using adalimumab because I reacted very badly on previous medications. Now I need to inject myself once every 2 weeks with adalimumab. Medications like adalimumab have a lot of side effects and it takes a long time to figure out whether they work or not. To figure out whether they work, I need to have a lot of hospital appointments, and my hospital is at the other side of the country, so that takes a lot of time. The biosensor would help me with measuring the adalimumab in my body. This would help me to get a more optimal treatment and to know whether the adalimumab is indeed suppressing my inflammation. Unfortunately, my arthritis will not disappear, but with the current medication and treatment, I am able to do whatever I want to do. I am not sure what the future will bring for me, but that's unsure for everyone.
So, as Wendy already told you, a biosensor that can measure adalimumab would be really helpful for her. And that's why we organize SensUs, to improve the quality of life of patients like Wendy. So now, 14 teams from all over the world have taken up the challenge to build a device that can measure adalimumab. And that's really difficult. So, dear teams, dear hardworking students, thank you for your enthusiasm, for your contribution and your motivation. Thank you for trying to improve the lives of people like Wendy. I want to wish you all a lot of good luck and success today, and I'm really excited to see what you've come up with. So, yeah, good luck. Thank you.
All right. Thank you, Kirsten, for this talk. As you can see on the slides, we're going to continue to the 1-minute pitches. So each of the teams has got one person that will talk to us for 1 minute about what they have developed and what they are showing to us today. So I would like to ask all team members that will give a 1-minute pitch to please go to your assigned seats, and then we can quickly start. And they must know that I'm going to time them, so if they're going longer than 1 minute, then I will cut them off, because it's a 1-minute pitch, not 1.5, of course. So we're going to start with the first pitch. My timer is right here, and the first team is the United States. So please welcome the United States to the floor. Yes.
Good morning, everyone. Thank you for coming out today to support this wonderful show of student innovation. My name is Sarah, and I'm here representing SensUs from North Carolina State University. For the past 10 months, we've been working hard to develop our biosensor for adalimumab monitoring, the AccuFret. The AccuFret, as shown on the left, is a small and compact device that can be used on both battery power and when plugged into the wall, making it ideal for in-home and in-hospital use. When a patient or a provider wants to run a sample on the AccuFret, all they have to do is load their sample into one of our single-use disposable cartridges and press the Start button on the user interface menu as shown. Then they'll receive their adalimumab reading within mere seconds. The AccuFret is low cost and guaranteed to provide healthcare savings through both dose adjustments as well as reduction of physician visits. We've worked really hard on developing the AccuFret this year, and we're excited about our results. So please come visit us at our table to learn more. Thank you.
Yes, great. Yes. Thank you. The next speaker will be the Netherlands.
Imagine you suffer from pain due to rheumatism. You would like to get the right dose of the medicine adalimumab. Therefore, it's important that the concentration of adalimumab in your blood can be determined. I am Selina. I represent TESS, the TOE sensing team, and we have developed a novel biosensor to measure adalimumab in blood plasma. We use a unique technique which measures color change from green to blue. That way, the concentration of adalimumab can be calculated. You'll get the same result in the desert as on the North Pole. Amazing, right? Moreover, our system can be used for the detection of other therapeutic antibodies. In short, drug dose monitoring with our biosensor can decrease your pain and make you and other patients happy. Are you curious? Visit us.
Yes. Thank you. The next team is Scotland. So give it up for Scotland.
Hello everyone, good morning. My name is Elaine. I'm a team captain for the glass sensor team from the University of Glasgow. So this year's team consists of 8 students from 3 different disciplines, from biomedical engineering, biologists and electrical engineers. I'm incredibly proud to be part of this team. We've worked incredibly hard the last 9 months, as every other team here. But I would like to present something quite unique. We have actually made basically a homemade sensor. Every part of our biosensor is made from raw materials, from the electronics to the cartridge itself, and also to the box you see on our market stand. And we're able to develop an assay that can quantify adalimumab using a single technique, and that is heat. I do not have enough time to explain that in 1 minute, but I hope that is enough to entice you to our market stand, which is out there, and it's the furthest stand from the caffeine. I'm very sorry about that. That is not planned. Thank you.
Thank you, Scotland. The next team is Egypt. So please give it up for Egypt.
Good afternoon, everyone. I'm here to represent my team coming all the way from the American University in Cairo. So for the sake of time, I'll just give you a brief of our device, other than the slide that you see behind me, that will make you for sure want to pass by and know more about it. So with the help of different areas of expertise within my team, we were able to build our biosensor device using a branch of electrochemistry that's new and holds a provisional patent. We managed to achieve great results that will make the device one of a kind, that will make our device one of a kind in fulfilling its purpose. And for this reason, we believe it stands out. And thank you so much.
Thank you, Egypt. The next team that will give a 1-minute pitch is Portugal. So give it up for Portugal.
Hi everyone, my name is Nuno Gonçalves and I'm one of the team captains of SensUs. It's the first time a Portuguese team is competing and we are very excited to be here. Unfortunately, our biosensor only arrived yesterday afternoon and it had a really rough ride. We did our best in the available time that we had and now we are ready to compete. Just to give you an overview, our biosensor has 3 main components: a gold nanoparticle solution, a detection scheme, and a user-friendly mobile phone application. It's easy, fast, and quick to use. So, if you guys want to know how the Portuguese team did its magic, please pass by our stand. This is us, SensUs. Thank you.
Thank you, Portugal. The next team is the United Kingdom. So give it up for the UK.
Hello everyone, I'm Ang Harrod, one of the team captains of the joint venture team from Imperial College London, and we've spent the last few months building a biosensor and an app called Ada to bring here. So at the moment, adalimumab patients don't really have a lot of choice with their measuring. The tests are really expensive, slow, and need a full blood test. But our biosensor only needs 1 drop of blood, gives a reading in less than 5 minutes, and is cheaper than all the alternatives. But also, we have an app where patients can log their symptoms every single day from red to green with a sliding scale and write comments. So when they go to their doctor's appointments, they can show their doctor which symptoms vary with dose and which day, so they can get better treatment and get better feedback, just improving their lives, basically. So come vote for us on SensUs Digital. Come visit our stand. We're just down that end. And thank you.
Yes. Yes, thank you. The next team giving a pitch is Germany. So give it up for Germany.
Whoa, this is big. Good morning. So we have identified some changes in the European pharmaceutical industry, and we have come to the conclusion that one of the biggest manufacturers of adalimumab, Humira, that is Abbott, should differentiate or servitize in the market. And for that, we introduce to you YOMU, you only measure once. So our sensor is a really innovative multimodal measuring system. So it not only enables, it gives very accurate results, not just that. For a pharmaceutical like Abbott, you need to not just sell drugs, but you need to be more customer-centric, or in this case, more patient-centric. And with our 3S, or the triple S secret sauce, we will make sure that your company is not just fighting to be in the market, but to be on top of the food chain. And to know more about our sensor, have a visit, visit us, and talk to one of our brilliant engineers. Thank you.
Thank you. Right, that brings us to the next team, which is Sweden. So give it up for Sweden.
Hi, good morning, everyone. My name is Therese. I'm not a team captain, but I'm very happy to be here anyway. Representing Uppsala University this year is AddUpSense. We are 12 members from different academic and cultural backgrounds. So we have a huge diversity. And we are here to present our biosensor, Odin. So as you heard from the beginning, around 1% of the world's population are affected by rheumatic diseases, and it associates with a lot of pain. So how amazing would it be if we could create a biosensor that could actually help the patient monitor the treatments more easily? Enter Odin. So Odin is based on an electrochemical approach, and it has 5 key steps. In simple terms, step 1 is the functionalization of the electrode, which is a key part of our very compact biosensor. Step 2 is the addition of capture antibodies. Step 3 is just adding the patient sample. And step 4 is simply running the measurement. And after these steps, in step 5, you would actually find the drug concentration presented in our very user-friendly app that has a lot of fun functions. So if you're interested in hearing more about Odin, please come and visit AddUpSense's stand. We're at the end of the hall here. And thank you so much for your attention.
Yes. Thank you. All right, the next team is Canada, so give it up for Canada.
Hello Eindhoven, we are Biosensum and we represent Canada, land of great music and poutine festivals. In fact, we all come from the same city, Montreal. Together, we designed a portable instrument, the Biospectrum. But what is so special about Biospectrum? It uses something each and every one of us has. A cell phone. That's right. We created an app that allows you to take your Humira blood concentration measurements, consult your results in real time, and communicate them privately to your doctor from the comfort of your own home. But how's that possible? Come to our booth where you'll be able to play a game we included in the app to help you better understand what goes on inside the instrument at a molecular level. If you rank best, you win a very special Canadian prize. Thank you, and we look forward to meeting you.
Thank you. The next team is Team Spain, so give it up for Spain.
Hello, we came from Barcelona. That it's a city that has improved a lot the last years in healthcare and also in technology. Thanks for all the companies and investigations that are there. And this is basically the key why we are here. We have came here with a total of 2 biosensors, one built it especially for hospital centers and another one as a home device for the patients. And also we designed it a reactive strip with a second line test so we can guess if the antibodies of the patient upsets this medication, so we can have a faster alternative solution so he can get the medication. And also Spain, it's like more or less how you know it, Barcelona like for the sun, the parties, the sangria. So we made like, for waiting about the test is done, we created a virtual reality game that you also can prove it in our stand. And also if you come, you are going to have really good cheese and ham from Spain. And that's all, so thanks for seeing us. Please come to our stand and please come to our city. And one last thing, a really big applause to all the people that you see here in the photos, because we have these students, this couldn't be possible. That's for you.
Thank you. The next team is Team Switzerland. So give it up for Switzerland.
Sorry. 6 months ago, we realized that the current situation for rheumatoid arthritis was suboptimal. Today, we came up with a solution. We aim to put the patient in the center of the medical process. With our products, no more venous blood sampling, faster analysis results, and digitalization of personalized medicine. Let me introduce you Sam, the Swiss analyzer multiplexer. SAM is based on a new detection technique never implemented on a biosensor. It can deliver results with only 1 drop of blood and in less than 10 minutes. Tests cost 10 times cheaper than usual medical tests. SAM is ultra sensitive. And the icing on the cake, SAM is a multiplexer. With only 1 test, we are able to detect several biomarkers. So do you want to meet SAM? Come to our own stand, and I promise you 2 things, Swiss precision and Swiss chocolate.
Thank you. The next team is Team Denmark. So give it up for Denmark.
At Detectors, we care. Therefore, we have built our sensor from scratch. From our peptide for drug recognition, to our microchip, all the way to our custom mechanical setup. To determine the specific concentration of the drug, we have used we use SPR, which consists of a laser and a one-dimensional camera. Our sensor and chip is very easy, cheap to produce. Therefore, our business model is based on selling to the hospital and then paying per patient. This way, we create low economically entry points for the hospitals, while at the same, which will make it very attractive for the hospitals. Through our participation in an accelerator and through extensive market research, we have discovered there's a big market for our product in Denmark. Our team consists of 13 students from 7 different countries and 8 different lines of study. All this brought together has allowed us to create the first personalized drug monitoring system in Denmark. Help us take arthritis patients into this century because we care. Thank you.
Thanks. Thank you. The next team is Team Belgium.
Treatment with adalimumab can be inefficient, but we have a solution for that. The patient only needs to apply a drop of blood to the cyanochip and push the activation button. Our device takes care of the rest. The sample can be filtered and mixed on our innovative cartridge without the need for expensive robotics. The self-powered microfluidics lead the sample to the detection area, where it is accurately measured in 120 seconds, thanks to our unique fiber optics and our exclusive antibodies. By partnering up with the pharmaceutical industry, we are able to offer more than just a device. We have listened to the patients themselves, and we want to build an entire community connecting people with RA globally for an all-encompassing healing experience. The unparalleled specificity, real-time detection, and most convenient ease of use make the Sino sensor the new must-have tool for any doctor's office. Thank you.
Thank you. That brings us to the last pitch, which is by China. So please give it up for China.
This is our second year during the census, and we took 30 hours from there to there. And this year we bring our biosensors named Bishen from ancient Chinese legend, and this is our just a glimpse of our products and our group, our campus. And as for our biosensors, Bishen is a name carrying our wishes of accurate and precise and a rapid detector. And we use optical waves, a brand new one without label. And I think it was a size on it. And on the exhibition stand, we brought gifts from China, and maybe you should have a taste on it. Yeah. I think that's all. Thank you all.
Thank you. I'd like to ask for one more applause to thank all of the speakers representing their teams today. So, thank you. Yes. You can go sit back in your seats. Yes, thank you. We're going to quickly go on to the next segment of our opening, which is a talk by Renate Richters, who is the councilwoman of the municipality of Eindhoven, where she focuses on healthcare and well-being. So it's very special that she is here today to talk to us. So please give a warm welcome to Renate.
Well, thank you. And good morning, everyone. I'm Renate Richters. I'm an element for youth, care and welfare, and poverty management. And I'm very excited to be here this morning. And I've already learned a lot. This is not my daily fill of the day, so to say. On behalf of the mayor and my fellow aldermen, I'd like to welcome you all to Brainport Eindhoven. Here, high-tech and design go hand in hand with high-quality manufacturing and entrepreneurship. Cooperation between government, businesses and knowledge institutions form the basis for the distinctive open innovation that makes Brainport smart and strong. SensUs, the international future healthcare competition for students, which I'm told is intended to stimulate innovation and education in the field of biosensors, is all taking place at the Technical University of Eindhoven. And you will be working in cooperation, just as happens in Brainport, and creating a platform in which businesses, healthcare organizations, universities, and other stakeholders can inspire and learn from each other. I'm glad to see an event involving some 165 top technology talents from all over the world being held in Eindhoven. And I'm happy that you have had the opportunity to get to know our city a little bit better. I believe you took a city tour, visited the high-tech campus, and took part in an Eindhoven quiz. I don't know what that may be. Very exciting. You are the future fuel of the technological solutions needed for many societal issues. And we are engaged in a global battle for talent. That means you. I hope that in the time you are here, you have been given a positive impression of Eindhoven and what the city of expats has to offer in terms of working, living and free time. Brainport is a stepping stone to a successful career. The municipal country of Eindhoven thinks it is important that we, as a city, are aware of the effort that students and international students make in their search for innovative solutions. And the wonderful thing is that you want to solve healthcare issues. Elderly people are living longer and want to be self-reliant and participate in society for as long as possible. The younger generation would also like a high quality of life. But unfortunately, the number of chronically ill and vulnerable people is increasing across the board. And this is particularly sad for the people themselves, of course, but it's also undesirable in a social sense, and it forms an economic problem. The already shrinking workforce cannot afford to lose people to illness. Health is therefore one of the focus areas within Brainport, a community to vitality, to promote physical and mental vitality in order that people are fit to participate in work and society and continue to do so. As an elderman for care, I also want to take a closer look at what kinds of technical innovation can improve everyday life. And I find what you people do very interesting. Stay committed to innovations in care. But I'll stop now. A strict schedule, and because I want you to get started on what you came here for, to find out which of the 14 teams has developed the best biomarker. I wish the jury wisdom. They will be judging you on creativity and the business aspect. And I'm curious to see what viewers from all over the world think of your innovations. I wish you all very good luck. Thank you.
Thank you, Renate, for your contribution today. Which brings me to the next part, which is the program of today. You've all received a booklet like this, and on the second page, you can find the program in more detail. This is very general. As you can see, at 11, the testing event starts, so we have 15 more minutes left before we start, so I'm not going to focus on this too much. But what I do want to say is during the testing event, please make sure that you don't touch the tables that the biosensors are on, because that could, of course, influence the measurements that they are doing. Also, during the day, you can walk around the market and you can visit pitches, technical and, as you can see here, technical and translational pitches. Those are downstairs. And stage 1 you can find when you go down the stairs over there. And stage 1 you can find when you go down the stairs over there. So please keep that in mind. Also, there are workshops today for which you can register at the doors. And also, for the first time, we have a high school project. So students from high school have also participated, and they are here today to show what they have found. Please come back here at about 4:15 when we will have the closing ceremony, which starts by a keynote lecture from our keynote speaker, Marien de Jonge. And that will be followed by the award ceremony. So please come visit that, because it will be very exciting, because the winners, of course, will be announced, and they will get those wonderful awards that are already standing here today. And at the end, there's a network drink where you can talk to all the teams, but also to the jury and to the SensUs organization. So please come visit there as well, because, for example, if you have questions during the keynote lecture that you have not got answered during the closing ceremony, you can, of course, still go talk to Marien at the network drink. So before we close, Kirsten would like to say a few more words. So please give her a warm welcome to the stage again.
Thank you, Annabelle. So a large part of the program that Annabelle just told you is also being broadcasted live via SensUs Digital. This includes, for example, this opening, the team pitches, and also the award ceremony at the end of the day. But there's even more. All online visitors can actively engage themselves in this event today by watching the live stream, joining the Q&A, checking out the live results of the teams, and very importantly, by voting on their favorite team. So that brings me to the first award that will be handed out today, which is the Public Inspiration Award. The winner and the runner-up of this award will be determined by you, by the public. Every one of you can vote on their top 2 favorite teams online. Keep in mind that the voting will close at 3 o'clock Dutch time, so UTC +2. So please make sure that you vote before that in order to help your favorite team win this award. The next 2 awards that I'm going to explain to you are judged by a jury. And you can see them over here. The first group on the right is the jury for the Creativity Award, and they will assess the creativity of the concepts and the devices that the teams have built. The jury consists of mostly university representatives, so from every university that participate, there are some people that will join this jury. Also, there will be a clinical chemist, and the jury is chaired by Steven Staal. Sorry, I'm pronouncing it in English, but that's not right. Steven Staal, and he's from Medimate. And the Creativity Award will be given to the team that came up with the most creative and novel technical solutions. The other award that's going to be given out by the jury is the Translation Potential Award. And this jury group consists of professors, medical professionals, and industry representatives. And Marco Blom, from our partner Marcronit, he will chair this jury today. The Translation Potential Award will be given to the team that came up with the device that has the most potential to make it to the market. Business aspects and financial viability will be taken into account, as well as the added value for patients. And then, last but not least, we have the Analytical Performance Award. And this award will be given to the team that has the best performing biosensor today. So it's a really important award. The prize will be awarded to the team that scores best on our self-developed algorithm. And this takes into account accuracy, precision, dilution, speed, and volume. The outcome of this algorithm is evaluated by the jury again, and this will eventually bring us to the winners of this wonderful award. So that's all the awards that can be won today. I want to wish the jury a lot of good luck and success, because I think it's going to be a very hard task for you to decide on the winners. So everyone else, have fun. To the teams, good luck. And I hope to, I'm very eager to see who's going to win the awards today.